Welcome back to UBC TV Health Facts Program. Know your body. And my name is Kirabo Caleb Kimeze. As usual, we are here to talk about health. Well, we all know September. September in health is all about knowing about childhood cancer. This is the month we commemorate childhood cancers. We let the people know more about pediatric cancers. Well, we all know that the WHO, that is the World Health Organization, it came up with statistics where they say that about 400,000 children and adolescents, that is between 0 to 19 years, were found to be having these childhood cancers. So this time around, we are here to remind the people more about these cancers and instill hope in them. With me in the studios, I have a visitor. She's going to be talking to us more about these cancers. Well, she's a person who has had cancer since her childhood, and she's going to be telling us her own story. Well, you're most welcome, madam.
Thank you.
Say hi to the dear viewers.
Yes. Hello, my name is Caroline Akello. I am a breast cancer survivor of 5 years.
Wow.
But I have also worked with an organization that supports children living with cancer. And currently I'm a member of the Uganda Women's Cancer Support Organization. And what I do is advocacy. I also do voluntary counseling, and we support patients and help them, direct them to the right place to get the right treatment. Because as people who have gone through this ordeal, we know that early detection saves life, and even if a person is diagnosed late, they can live a comfortable and healthy, productive life as long as they adhere to their treatment.
Wow, thank you so much for that introduction. Well, your CV actually tells me something as a person who likes inspiring the young people. Well, listening to all that, it actually inspires the people outside there, because the moment someone is diagnosed with cancer, the only thing they think about is I'm going to die, and my days are numbered, and I don't feel like I can be any person in this world. Well, hearing that from you, that you've worked here and there, you've inspired people, it is actually telling me that there is a lot more people can live for. Well, madam, it seems that you know a lot about cancer. What do you think cancer is?
Yes, cancer by definition is the abnormal growth of cells.
Abnormal growth of cells.
Yes.
Well, what do you mean abnormal growth of cells? Because is the cell growing in a way you don't want? Some more light about that?
Yeah. Okay, I'm not medically qualified to discuss it, but what I understand about that is that our cells, a normal cell is supposed to grow and divide in a certain way, but then and then they die eventually. And the body cleans itself. But there are these particular cells that instead mutate, and they start to rapidly multiply in your body, and then it becomes a cancer. It devolves into a tumor, something like that.
Wow, you sound like a real scientist. Nothing much I can add about that. Well, actually, the dear viewers, what he's actually trying to mean that these cells in the body have a particular time at which they are supposed to grow and a particular time they are supposed to die. So what happens in cancer, that there is a continuous growth. If a cell is supposed to grow and die at a particular time, these cells surpass that time and they grow so much quickly. Is it what you try to mean?
Yeah, something like that.
Well, you say that you've been with this cancer for quite a long period of time. Which time were you diagnosed with cancer?
I was diagnosed in 2018.
2018.
Yes.
Roughly how many years are those?
5 years.
5 years.
Yes.
But you look beautiful, strong and energetic.
Thank you.
It sounds to me that you've managed to beat it down.
I am still battling, but I have really improved.
You've really improved.
Yeah.
That is so good news to the people watching. Well, I have a few questions for you, and especially the people viewing. Maybe they're much more interested in knowing. How did you know that you have cancer? Because in most cases, these things develop and we are unaware. And sometimes when we go to hospitals, it is some of them lately detect that it is a cancer. What did you base on, you as a person, first of all, and to say that this must be a cancer?
Yeah, I first sensed I discovered a tumor in my breast. That was around 2015.
2015.
Then I consulted a health worker who worked in a government facility. She examined a little bit and she said it wasn't something serious, it was just a milk duct. But the tumor kept growing. Then around 2018 early, I noticed there was a depression in my breast.
Oh.
And then that particular breast was growing smaller than the other. So I realized it was something that I shouldn't take lightly. And I asked a friend who is a doctor who helped me get some help from another government facility. Yeah.
Wow, that is so beautiful. The dear viewers, hope you're hearing her story. As she says that to any lady out there, if you feel like there's a lump growing into your breast, we say that don't sit down. Please go and see a doctor. If possible, they can actually do some examinations, or they can do some scans to rule out any kind of malignancy. She tells us that the first time she realized that it could be a cancer when she started developing such symptoms like developing a lump in the breast and the breast growing actually smaller than the usual, plus some other symptoms. Well, that's when you decided to see a doctor.
Yes.
But we want to actually know, what did they base on to diagnose you? Because not every growth in the breast is a cancer.
Yes, that is true.
Yeah.
Actually, ladies should not fear that because they have a tumor, it's a cancer.
True.
Many tumors are not cancerous. So I had a depression in a breast. And usually those depressions are so suspicious.
Suspicious.
Yes. So the doctor that I saw, actually this time in a private facility, asked me to do a mammogram.
A mammogram.
Yes.
True.
So the mammogram showed it was highly suspicious, and that's when they asked for a biopsy. Yes.
Well, in the start you told me that you're not a scientist, but the terms you're using, a biopsy, actually she's trying to mean biopsy is when you get a tissue and then take it for further studies to rule out if it is a cancer or not. So she tells us that the time she was diagnosed with cancer, they did a few investigations, that is mammography. Mammography is actually taking, let me say in the easiest language, a picture of the breast, isn't it?
Yes.
And then the biopsy, like I've said, is taking off the soft tissue. Now, at that particular time, I know you looked very scared, and you looked even to be very young. How did you feel when they told you that this is cancer? Or maybe before telling you that it was cancer, how did you feel when the doctors started telling you that we suspect this could be a cancer? The emotions, how did you manage that?
When it comes to emotions, for me, I think first, before it was confirmed, I was hopeful that it may not be. It may or may not be. There are moments when I got anxious, but there are moments when I had the hope that it might not be cancer.
True.
Because my doctor had told me it's not cancer until it's confirmed.
True.
But after the diagnosis, I think I was more in denial. Although I went through with the treatment, but in me I felt like this can't be happening.
This can't be happening.
Yes, because I never imagined in my life that I could suffer from cancer.
At that particular time, you see, our dear viewers, they're much more interested in knowing. You see, I'm going to give you a simple scenario. As young as we are, we kind of have a few problems that trouble us. One of them could be food. When you don't have food, you're worried. When you get poor grades in class, you're worried, and you feel like you should not eat the whole day. I just want you to bring out that feeling. You know, some people say, I closed myself in the room for quite a long period of time. Maybe I didn't want to talk to anybody. How was it with you?
Okay, actually for me, I kind of isolated. I didn't want to talk.
I know.
I didn't want to talk about it because I didn't want that pity. I felt like people will look at me and start to pity me because I have cancer. I didn't want to talk about it. Yeah. So I told a very few people, especially family. Yeah. But otherwise, I didn't want to talk about it.
At that particular time, well, you say that you are in denial. At what time did you pick up yourself and you said, okay, fine, let me embrace this. This has come. I want to hear from you. Did you get anyone to counsel you, to talk about it more until you accepted that, coming out of that denial stage is not something easy?
Yeah, that's true, actually. The day I was told I had cancer, at that time, I was already volunteering with the Uganda Child Cancer Foundation.
Oh.
Yes. So the program's director by then, Mr. Benny Kara, was aware of what happens to patients when they're told about this.
Cancer.
So he called a breast cancer survivor, the director of the Uganda Women's Cancer Support Organization, Ms. Gertrude Nachigude.
Yeah.
And to my advantage, she was within the Uganda Cancer Institute campus, and she immediately came and talked to me and gave me her experience and helped me realize that this thing, I can fight it and I'm not alone in the journey. And to be honest, they have never left me alone.
Wow.
Yes.
That is kind of inspiring. Well, I want to also tell the dear viewers that, you see, when such conditions come, one of the things you should understand that this thing is not starting with you. And I want you to actually look at people like her today in the studio. She says that, well, someone talked to her and she was given hope. And today she has survived for about 5 years. Well, I want to know, you see, this community is not something that embraces such things. How did the community, react to it? Because at that particular time, I understand that you left denial, accepted, embraced. And the people around you, of course, they were there to support you. But the community, and you see, the community has myth. How did you face the community? And what did they tell you when they heard about that?
Yeah, actually up to date, when people see me, you can see the pity in their eyes.
I know.
Yes. I have even had others say, you should stop treatment and just manage the pain as you wait instead of struggling with the treatment, because chemotherapy treatment and generally cancer treatment is very difficult treatment. Yeah, I've had those scenarios, even sometimes from family members. Sometimes those words come out involuntarily.
True.
Yes. But for me, what I do is I focus.
You focus.
I focus on myself.
It is the positive attitude for you.
Yes.
Wow.
And I am a mother. I have a daughter that needs me. So I can't just give up like that. I have to fight on every day.
That is interesting. Well, so we've accepted starting treatment. Did you have any hope at any moment that cancer heals?
Yes. I have associated with people who have survived cancer 20 years plus after treatment.
20 years plus.
They are my friends. So cancer is treatable, and it's not only that. We even have people who have been cured from leukemia, and they are my friends. So I know cancer is curable.
And by the matter of fact that leukemia seems to be one of the most dangerous types of cancer, isn't it?
Yes.
Well, you've told us that you have friends who have healed from cancer. And we've heard from doctors, they tell us that cancer is actually categorized based on stages. Do you think if I come on with cancer, or if I'm lately diagnosed, or maybe I was misdiagnosed at the start and then I'm diagnosed lately, do you think my cancer is likely to heal? Maybe if I come in stage 4? Okay.
The truth is, stage 1 and 2 are curable.
Are curable?
Yes.
What do we use to treat, to cure that cancer at stage 1 and stage 2?
Depending on the cancer, for leukemia, the main kind of treatment that is given to patients is chemotherapy.
It's chemotherapy.
For breast cancer, there is chemotherapy, there is surgery, and radiotherapy. So it depends on the cancer.
Well, the dear viewers want to understand what chemotherapy is. You know, we've watched it in movies. What do you mean with chemotherapy?
Okay, it's chemotherapy. It's actually given intravenously.
Intravenously?
Yes.
Do they keep on injecting medicine to you?
No. At the Cancer Institute, we have pharmacists who mix the medicine into normal saline. So that medication is given according to each patient. What I get is not what another patient will get. It might be the same type but different quantities or different combinations depending on the cancer, its stage, and the level of seriousness of the disease. Yes, but yeah, that is it.
Well, you talked about stage 1 and stage 2. Any other stages you know about cancer?
Stage 3 and 4.
Stage 3 and 4. Stage
3 is difficult to treat, and actually I was diagnosed at stage 3.
Stage 3.
Yes. Stage 4 is also difficult to treat, and in most cases, stage 4 cancer patients are likely to survive a few years and die, but there are those also who have cured on stage 4.
I know.
Depending on how it's handled.
What makes stage 3 and stage 4 complicated like it sounds?
Because at stage 4 it means that the disease, stage 3 and 4 it means it has started to metastasize. Stage 3 actually it just starts. At stage 4 it has metastasized, meaning it has spread to other body parts.
So for you, you were diagnosed with stage 3 of cancer.
Yes.
And here you're telling us that stage 3 and stage 4 seem to be complicated. Yes. And you're using the word metastasis. That means it has almost spread to other parts of the body. And there you were, standing little like you were, with a lot of hope that I'm going to get better, yet you're diagnosed with stage 3.
Yes, I have hope because there is treatment. I'm on treatment. When I started, it was bad. Along the way, I got a bit seriously sick, but now I'm much better.
You're much better.
Yes.
Well, the dear viewers want to hear from you. You see, cancer is not something that is so easy to beat. Well, you can manage to beat it with medication, chemotherapy, and the blood you've talked about. But the community, how to deal with. Briefly, can you tell us the challenges you found as a person? How have you dealt with them? Which kind of challenges you faced, and how have you tried to maneuver through them? And if there are any that you've not maneuvered, do you have hope that you'll maneuver them one day?
Yeah. Okay, the biggest challenge is people view cancer as a death sentence.
A death sentence.
Yes.
That is the end of life.
So the moment you're diagnosed with cancer, people start to prepare to bury you.
That you reserve the other piece of land is for so and so.
And you see, sometimes they don't intend to say the things, but they come out. Or you see people going and coming to see you, and the first thing they do is cry. So there is that challenge. You're trying to be positive, you're trying to be strong to face this big challenge. You have this big battle. It's cancer. It's not going to get cured in one day or a week.
True.
It will take long. And these people are negative energy kind of. So for me, what I have done is the people that I let in are those who are positive. If someone is so negative, I cut you out.
You're actually trying to prove the other statement one scientist made that, well, we give medicine, but healing sometimes is psychological.
Yes.
So you had to build a positive attitude inside you and let go of the negative.
Yes.
Well, I think that is one of the challenges we face. The second challenge.
The other challenge is when cancer comes, it changes everything.
I know.
You never remain the same. First of all, your visits to hospital are so frequent. The finances that are involved making those visits, and sometimes to pay for certain tests that may be needed by the doctors, that is also money.
I know.
And remember, when you start treatment, you really get weak. Once you get chemotherapy, you cannot wake up in the morning and say, I'm going to work. You may need a week or so. So if you're working privately, in a private organization, a company, you may be laid off. And remember, these bills will keep coming. these needs are there.
You a mother. You need school fees for your children. You need to bring food on table. I know.
Yeah. So there is that challenge, maneuvering through it, and somehow we are getting there.
Wow. Wow. So any other challenge that sounds to be, well, sometimes it can be managed by the psychologist, or sometimes could there be some challenges that a person with cancer really feels, and it is really so hard to trek through them?
I can say the period of treatment is really long.
It's really long.
And you can't guarantee and say, I'm going to be treated this and it's gone. Like my first period of treatment took about a year.
Quite a lot.
Yes. I did chemotherapy for 5 months, surgery 1 month. Of course, that is surgery, healing, and yes. And then radiotherapy went on also for like a month, because radiotherapy was for 28 days. So it took me up to around December to complete the whole thing.
Wow.
And that is normally what happens to breast cancer patients.
Wow.
Yeah.
Well, because of time, well, I'm much more interested in at least knowing that you told us that cancer heals, and you try to outline for us the different types of management, or the different modes of management that cancer patients go through. Can you please give us a recap? And if any, like chemotherapy you talked about, is it all about coming and they give me their medicine and I go away? Tell us more about the visits. How often do I come to the hospital, and how do I deal with that, the medication part of it?
Yeah. Actually, when it comes to treating cancer, you don't just wake up and go and the doctor tells you have cancer. First of all, they have to start with a biopsy that confirms whether or not you have cancer. If it's there, and then they will require you to do certain tests. You have to do the heart test, and then other organ function tests, and then there should be a CBC. Sometimes they request for CT scans for the abdomen and the chest. Yeah. Then after they confirm that your organs are functioning well and you can handle the treatment, and then they will prescribe chemotherapy. That is if chemotherapy is the best way forward.
True.
For some cancers like cervical cancer, they can start with radiation. But still you have to do all these tests before they start. So for chemotherapy, the commonest interval is 3 weeks, 21 days intervals. So you go back every 21 days.
21 days, roughly about 3 weeks.
Yes, and normally they give 6 doses of chemo for a patient, but there are times, depending on how the disease is, they may go for 8, depending. Yeah.
Well, thank you so much for that story, but some more interesting now. Do you think there is hope for the young people that have been diagnosed with cancer?
Actually, children are the easiest to treat, because they are still growing and their body cells can be managed more than an older person. Children are easier to treat, and children cure more than the older people.
You told us that you were diagnosed with cancer in 2018 and you started developing a lump in about 2015. How old were you?
By the time I was diagnosed, I was 30. 30 years.
30 years. Wow. And I see you look like you're in your sweet 16.
No, I just look.
Okay, well, having instilled the hope in us, what do you think that the people outside there, the community, the government, maybe the action plans, what do you think is much more needed to improve the management of cancer, especially in our mighty country, Uganda?
First and foremost, the community, the people generally, need to know that cancer is not a death sentence. If diagnosed early, it's curable. Even if it's diagnosed late, there is still hope for cure or prolonged life. Someone can live for even 20 more years after diagnosis on treatment.
On treatment?
Yes.
Even in stage 4 and 3?
Yes. It's possible. If well managed, someone can live long. The other thing is, I think we need a lot of sensitization of the people. Yes. People need to know what cancer is. I remember when HIV came out, everybody, right now, if you talk to anyone, they can't tell you something about HIV.
I know.
But when you talk about cancer, there's still a lot of myths surrounding cancer.
So that communicates to me that a little has been done by the media or by the people concerned in bringing the knowledge to the people down there.
Yeah, people need to know. Because the more they know, the more they will seek help before it's too late.
I know.
Yeah. And then what I think also needs to improve it, I don't know whether it can be the education system or something like that, but medical workers in general need to be more knowledgeable about cancer. Because trust me, 2015, I asked and I was told nothing to worry about. I kept going to different places, nothing to worry about, until I presented at stage 3. And this is a common scenario with most of the patients. They have not started looking for help today. Most of the time they have gone to private facilities or other government facilities, and they have been told it's something else. Some people have been treated for ulcers when it's breast cancer.
I know.
Others have been treated for ulcers and it's stomach cancer. So by the time they reach Cancer Institute, it's too late for them. Yeah, there is that. The other thing that can help is, let us motivate our workers. Cancer Institute is a place with a very high population of patients and a few doctors. If we want them to stay there and take care of our patients, government can do something.
True.
Motivate them. Give them the money. Let them be happy.
At that particular time, a friend of mine told me that everyone here in Uganda is trying to look for green pasture. If you're a doctor and you're an oncologist who deals with cancer, and you realize that there's a good deal in Sudan where they are paying quite a large amount of money, they are likely to fly out. Is that so?
It's a possibility. I can't say that I'm so sure that somebody has gone out because of the money, but it's a possibility.
It is a possibility.
It's a possibility.
Well, because of time, I thank you so much, Madam, for sharing your story with us. We are actually honored to, to host you, and I guess the young people out there are inspired hearing your story. Well, my last words, just like it is September, I'm not going to be like the other woman who says September to remember, but I'm saying that September is an awareness about childhood cancers. I want to instill hope in you that if someone has diagnosed with cancer, it is not the end of life. Like she said, you can actually live more years. Like for her, she was diagnosed in 2018, and here she is looking energetic, strong, and she's actually showing that she can actually push on for more 100 years. So what I'm saying, that if you're out there and you're diagnosed with cancer, I'm giving you the good news that the treatment out there is there. The chemotherapy, the radiations, and other modes of treatment, they have been brought on form. So the hope and future is bright. Thank you so much for keeping it on UBC TV. Let's meet once again the other Monday. Bye.